Come in.
Hi, my name is Chelsea. I'm going to be your nurse today. I've come in so I can give you your morning medicine. Is it a good time to get those ready for you?
Yes.
Okay, and can you just tell me your first and last name and date of birth, please?
Sarah J. 1193.
Perfect. And do you have any allergies that you know of, Sarah?
No.
Okay. So looking at the physician orders here, it looks like you are due to get your blood pressure medicine, the low pressor, and also the Colace, which is a stool softener. And so I will get those ready to go for you. Before I go out to the medication room, are you in any pain right now?
No.
Dang it. Pause it. I forgot. And before I go get your medications out of the med room, are you in any pain right now?
Yes.
You are. And on a scale of 0 to 10, what would you rate your pain?
8.
An 8 out of 10, okay. I'm sorry to hear that. And where is your pain at?
My back.
Your back, okay. Lower back, upper back?
Lower.
Okay, lower. And does it seem to get better or worse at any certain times?
When I stretch, it hurts.
Okay.
Worse.
And do you, would you say the pain is like a dull pain, a sharp pain?
Sharp.
Does it radiate anywhere else in your body?
No.
Okay. All right, so I got that in there. And then, so it does look like you can have some pain medication, some Percocet. And for that level of pain that you gave me an 8, it looks like you can have 2 Percocets. Is that okay?
Okay.
Okay, and it does look like it's been about 8 hours since you last had any Percocet, so you are able to have some now. And then also, do you want anything specific to drink to take those medications?
Water's okay.
Water, okay. And then, let's see here. It looks like you're on a regular diet, so I'll bring some water in. Are you able to swallow pills okay?
Yes.
Okay, great. And then before I give you your medicine, I will need to check your vital signs, make sure that your blood pressure and your heart rate are looking okay. So I will get your vitals as well. And then we'll go from there, okay?
Okay.
All right, I will be right back. Thank you. Okay, so now I'm in the medication room. I've closed the door so there's no interruptions. And I'm going to look at my meds here. So I have Sarah J. I'm checking my MAR as well. And date of birth 1193. No known allergies. Okay. So I'm going to pull her up on here. All right. And I'm also going to research my medicine real quick. So for Colace, it's a stool softener, also known as dietary sodium. Increases water and fat absorption in the intestines to allow for easier stool passage. Prevents constipation. Make sure I ask if she has any nausea or vomiting. Okay, and the dose matches up my order here, 50 milligrams. And then side effects, nausea, diarrhea, rash, cramping. I need to look for that. And then, so my Percocet or oxycodone. See, inhibits pain pathways, increases pain threshold. For moderate to severe pain, that matches up the order. We've got dose of 10 to 30 milligrams every 4 hours, which matches up. She's got 10 milligrams. Can cause drowsiness, dizziness, headache, blurred vision. And then I want to assess her respirations. And then the other one, metoprolol, or low pressor, lowers her blood pressure and heart rate. You make sure she doesn't have a history of COPD or diabetes. 50 milligram dose, which matches the order. Can cause heart palpitations, nausea, vomiting, diarrhea, blurred vision. And I want to check her blood pressure, check for edema, and her pulse as well. So I've researched my drugs here. Now I'm going to start pulling them out. Okay. So I'm going to open my med drawers and clicking my patient. We've got Sarah, and we have Colace here, so Sarah J. And then our order says Colace, and we got 50 milligrams. It's an oral gel capsule, so I have to make sure I don't cut it in half. And let's see, the time is now, and And let's see, I will document as I go through too. So I have my patient, Sarah, my med, colace, my dose 50 milligrams, my route, oral, my time is now, and then I will document it. So here is my first medication. And then I want our low pressor. And so that is 50 milligrams. So Sarah J, oral, low pressor, 50 milligrams, the time is now. And I just need to check her vital signs before I give that. Put that off to the side. And then lastly, her pain medication. I need to do a count, and that's for Percocet. There's 2 in the drawer, so I'm gonna type 2, and then it will subtract the 2 that I am taking out here. So 5 and 5, the dose is 10. And then, so we have Percocet, 5 and 325, 5 and 325, and it's an oral tablet. And time is now. It's a PRN med. I did check, she's good to get it. And then I also checked expiration dates on everything. Everything is good to go. So none of these are expired. And then I want to make sure I close my drug dispensing system and log out before I leave the room. And then I'm gonna get her some water, and then I will head into her room. All right, here I am at her room, and I'm going to pause before I go in and just do my second med check, or I could do it in the med room, but I'm gonna do it right here. So again, I have Sarah J, that matches the MAR and the orders that I have. And my first medication is for low pressor, 50 milligrams. This is an oral medication, it's a tablet. The time is now, and I will document it at the end. And then my next medication here is colace, 50 milligrams, and it is an oral tablet as well, oral tablet. Time is now, okay? And I will document that at the end. And then lastly, I have Percocet for pain of 7 to 10, and she rated hers an 8. So I have 10 milligrams, and for Percocet, oral tablet, the time is now PRN. All right, so now I can head into the room.
Come in.
All right, Sarah, I have your medications here.
Okay.
So I know that my nursing assistant was just in here and checked your vital signs. So it looks like your blood pressure was in normal range and your heart rate was within normal range. Would you still rate your pain an 8 out of 10 at this time?
Yes.
Okay. All right, so it looks like all your vital signs looked good and you can get these medications. So I just want to go through them a little bit with you before I give them to you. So the colace, which is the stool softener, so that is this pill here. So this one increases water and fat penetration in the intestines to help for stool passage.
Okay.
And it does prevent constipation. Are you having any nausea or vomiting right now?
No.
Okay, good. Because if you were, I wouldn't want to give that to you right now. And then that dosage is within the normal range for a dosage for the day. And then if you do experience any of these are well-known side effects, but just let me know if you do. If you have any nausea, diarrhea, any rashes, cramping of your abdomen, those do happen sometimes, but just let me know so I can keep note of that. And then I also have your low pressor here, and that is 50 milligrams as well. This is the one for your blood pressure. So it may look a little different than your one at home, but it does lower your blood pressure and your heart rate. So that's why we checked those and made sure those were good. You don't have a history of COPD or diabetes or depression, do you?
No, none of those.
I didn't see that in your chart. I just wanted to double check because that's contraindicated then. And then it can cause heart palpitations, nausea, vomiting, diarrhea. If you notice those or any blurry vision, trouble breathing, anything like that, let me know right away. And then we checked your blood pressure and I did an assessment and you didn't have any edema, any swelling of your legs. So I think we're good to go with that medication.
Okay.
And then the last one is the pain medication, the Percocet. So that one works by inhibiting your pain pathways to your central nervous system and helps to increase your pain threshold as well. So it's used for moderate to severe pain, which on your scale of 8, that is appropriate. And then the dose is good for what I looked it up in the med book. And it can cause you to feel a little drowsy, could cause a headache, blurred vision, dizziness, but do let me know if you feel any of those side effects. And if you do take this, especially if you go home and take it, don't take it with any alcohol, okay?
Okay.
And then I assessed your respirations and they were within normal range too, so I think we're good to go. So what I'm going to do here is I'm first going to scan you. Beep. Okay, and then I'm going to scan your medications here, your low pressor, so there's that one for you. There's your water for you.
Thank you.
And then here is Colase. And none of these need to be cut in half, but I would want to make sure if any of them did that they had a score on them. And then 2 Percocet. And there are those for you. And then last, I'm just going to scan myself. Okay. All right. So I will come back in about 30 minutes to check and see what your pain level is, making sure that your pain is starting to come down with that Percocet, okay?
Okay.
And then I don't have any liquid medications for you, but if I did, I would make sure that I mixed it well. I would make sure that I put my palm on the label when pouring it, making sure that I leave the cup at a level surface as I'm measuring it as well. But again, I don't have any liquids to give you right now. And so do you have any questions about your medications?
No.
Okay. Are you in a comfortable position? Are you going to lay back down?
I'm good here.
Okay. All right. So then here is your call lights. And then I want to make sure your bed is low. There we go. And it's locked. Your side rails are up. Do you need your tissues here?
Yes, please.
Here you go.
Thank you.
All right, so you got your personal belongings. Anything else that I can do for you right now?
No.
All right, so I will be back to check on your pain level and just call me if you need anything else, okay?
Okay.
All right,
Thank you.
Yeah.